The intro. Oh, we're live. And we're live. Hi, everybody. Welcome back to Bite Size Learning. I'm your host, Dr. Mike Sevilla, and we have a great topic here for you tonight. This week's session is all about how you can claim American Board of Family Medicine credit for the current work that you're already doing. That's right. I know. How can you do that? Well, we have a great panel that is joining us, a distinguished panel. Welcome, panel. Brian Batchelder, Brian Kaufman, and Anna McMaster, we're going to be talking about how you can get credit for the work that you're doing in your office right now. And we're going to go through some mechanics, and then we're going to talk about some stories of practical examples on what you can be doing. It's so easy, even I can do it. So, Dr. Kaufman, why don't you kick us off there and share with us how we can do all this?
Sure. So Abfm offers us the opportunity to do practice improvement credits. And most of you have hopefully already done some of these in the past, but in the past, they were often fairly time-consuming projects you had to do, whether it was a metric study where you pull charts and look at how you're doing on something and then change your practice, then come back and do it. But with the beginning of COVID, Abfm released COVID-19 Abfm Practice Improvement Project that basically was a really easy way to do a self-directed quality improvement project. So you could take something that we all were forced to do with our practice, whether it was figuring out how to adjust your schedule, how to do virtual visits, immunizations, or just plain how you keep yourself and your staff safe, and record a few of those things and get credit for it really easy. So you basically, this is something that I did very early on in this, and just wanted to kind of share this process with other people so that you can get the credit for what you're already doing and not have to do a bunch of extra work. Staff's going to put it up in comments here if they haven't already. Basically, a link to the video we created. But basically, it's just a web form. It takes probably 15 minutes to do it, and then it lets you get the credit for what you've already done. So that's kind of the whole idea in a nutshell.
Great. So there is a video that is available. OAFP created new tools, including a step-by-step video. And we are talking about things like COVID-19 practice interventions and other self-directed pathway tools to help Abfm diplomates help apply credit so they can get credit for what they're doing in there. And then before I have one of our other panelists speak, I forgot to say that tonight's session is part of OAFP's COVID-19 self-directed clinical pilot campaign that is being supported by a grant provided by the AFP Foundation Philanthropic Consortium, FMPC, which is funded by members like you. Help programs like this continue to support family medicine by giving to the FMPC when you go to afpfoundation.org. So I forgot to get that out at the top there. We have a couple of members who have done this process and shared this process. And Dr. Batchelder, why don't you share kind of your story and just let us know kind of how you got into this and kind of what your results were.
Yeah, thanks, Mike. I started working at ChenMed in Columbus in February this year. ChenMed's a value-based full risk system dedicated to low and middle income senior citizens with over 80 offices across the U.S. and presently has locations in Columbus and Cleveland and Cincinnati. I was needing Part 4 Abfm credit and noticed the Kaufman plan last winter. But I didn't have a clear-cut idea of how to apply it, so I kind of put it off to the side. A couple of months ago, I was reading the materials again and noticed that it could be used with immunizations. And I realized that at ChenMed, we had just completed about 2 months of immunization clinics for Moderna for our senior citizens. I asked one of our regional managers if we had kept records of the numbers of immunizations given, and of course he had. And he even provided me with a graph of the improvements. I answered all of the self-directed Part 4 questions per Dr. Kaufman's advice and applied our numbers, supplied the graph, and within 24 hours, I completed my project. But the story doesn't really end there. I recognize that ChenMed had done many of these COVID immunization clinics across the United States and in other centers, including Florida, Georgia, Illinois, Kentucky, New Orleans, Michigan, Missouri, Pennsylvania, Tennessee, Texas, Virginia. So I distributed my project along with the Kaufman plan to over 20 family medicine medical directors across the United States. And who knows how many of those FPs they sent it to. Two of my colleagues where I work was also able to use the plan as well. And they were able to actually sign on to the materials that I had already supplied. So using the Kaufman plan, I was able to complete my project. I think I did it in less than an hour, probably about a half hour the night before, and then a half hour where I inputted all the information and got credit in a relatively easy way. Kate, if you have that graph, you can put it up now. So as you can see, our baseline, we started at something around a little over 20%. And within 4, 5, 6 weeks, we were up over 70%. And that was one of the criteria is you not only had to have a plan of what you were going to do, but you needed to show success in some fashion. And knowing that we had really decided that something over 70% was needed for herd immunity to try to get rid of the COVID virus and suppress it. I used 70%, and luckily we achieved 70% as our goal. So I'm not sure I even watched the Kaufman video. I really just used the Kaufman plan and the materials that he sent along and found it very easy to do. There you go, Mike.
So, Brian, I guess diving into some of the details then. So, I mean, were you able, you got the data from the electronic record, or can you dive into a little bit more details on how you got your data?
So you also needed to have, to be really considered part of the Part 4, or to use this for the Part 4 ABFM credit, you needed to be part of the planning process. And fortunately, I was part of the planning process as to how we would apply this in our clinic itself. And as far as the materials, we knew ahead of time, ChenMed does a great job with numbers. And we knew ahead of time that we were something around 22, 23% with COVID immunizations. And we knew we had to get those numbers up. And yeah, those numbers were kept in the computer. Not only here in Columbus, but across the state. We have statewide numbers, and we also have numbers for across the ChenMed system. So there's a great system-wide numbers ability to keep numbers for us.
And so, I mean, obviously, part of this is kind of working with a team of people and people kind of to try to keep this in track and well, I mean, you probably said already before, what was your timeline as far as your data?
Well, we didn't find out until about I think even 3 weeks before we had our first clinic that we were going to be able to get the COVID vaccine. So I think we started about 3 weeks before we actually had our first clinic, and we were calling our senior citizens and getting them in line. We did it on a Thursday morning for 4 consecutive Thursday mornings. And then we followed it up with another 4 weeks of giving the second immunization to those who needed it, which was almost everybody.
Great. Now, Ryan, I mean, a question that I get a lot, and probably you get a lot. I mean, is there a minimum amount of time, to get your data or for this type of exercise?
So there's really not a minimum amount of time. This one's a little different than a lot of things. If you're looking at something like diabetes or heart disease, you got to get the patients in to do them. When I initially did my project, it was looking at doing televisits. And like most of you, that's one of those things that I implemented pretty much in a couple of days. And so for my project on telemedicine, it was something that looked at basically, the data I collected was for the month before and the month after, but there was a change that happened pretty quickly. So it really kind of depends on the data you're looking at, but this can be something that is pretty small and pretty self-limited. It can be something a little bit longer. Certainly if you're looking at something like vaccines, you're going to want to take a little longer time frame just because it takes a little longer to see that data there. But the ABFM does not specify a minimum amount of time. And to Brian's comment, you do need to be involved in some part of the process. You don't actually technically even need to be involved in the planning of the process. If you're involved in the data collection and the improvement piece of it, that's sufficient. So if you're a part of a big system and aren't fortunate enough to be in the room helping make those decisions as to how you're actually going to do it, as long as you're involved in the process of improving the quality and the data collection, that's sufficient to do it. Likewise, if you're in a big system and you're involved in the planning, but don't want to have to deal with being the one pulling all the data, you can have somebody else pull that data for you, and you still get credit. If you don't have to be involved in all parts of it, just some parts of it.
Great, thank you. Dr. McMaster, thank you for being here. Share your story with us.
My experiences were actually rather similar to Dr. Kaufman's experiences. As many of our family physicians, we pivoted from all in-person to no in-person very quickly when COVID came to the forefront back in April. I'm part of a larger health system, and our health system basically said one day, as of tomorrow, there are no in-person visits, period. So it was a rather an abrupt change. So I was actively involved in figuring out how in our small practice within the larger health system, how to make that mandate work for our patients. And then looking further down the road, 3-4 months down the road, we were transitioned back to in-person care, but the health system had a goal of trying to do as many of our encounters as virtual as possible. The guidance was pretty hazy. They just said, do as many virtual as possible. So it was really a pretty gray area. So each office was tasked with figuring out how to make that work. So we came up with guidelines, screening protocol for our front office staff on when patients called for the appointment, kind of gave them a triage type of protocol to decide, is this something appropriate for in-person? Is this something appropriate for virtual? You can't repack an abscess or do a pap test in a virtual encounter. That really needs to be an in-person. So really it was just developing and trying to figure out, where is that balance there for in-person versus the virtual. So that was kind of my hands-on what we did on the ground. And then looking at, okay, here's this practice improvement project. We did all this work just to take care of patients, something we did every day. And now we have this ABFM project that allows us to get credit for that practice improvement that we did. So I used Dr. Kaufman's video as kind of my jumping off point. It was very helpful to kind of see, walk through the process and say, okay, this is how we do that. So basically we took with the health system's goal of having as many in person, they wanted to do at least 25%, but preferably as many as possible. So we made a goal for our small office of 50%, ideally, but shoot for the health system's goal of 25. And we took just 1 month, right after we started really initiating the triaging protocol, which was September. So we took 1 month's data, September 1st to September 30th, and we really looked at those numbers, looking at the August data and then the September data, and we were able to see definitely a trend upward in the virtual visits. And also we were able then to compare able to get a hard number as far as what percentage of those visits were in person versus virtual. And our virtual visits in September then were 52%.
Wow, that's great. That's great. So Ryan, I guess I come back to you. I mean, I think the board isn't really, making this very complicated for family physicians. It's just you have a goal of some kind of patient care issue, an improvement issue that you can do in your office and going through the steps that you have outlined on the website. And it seems like a pretty straightforward process. Am I missing anything?
No, you're really not missing anything. The board has really made a nice pivot in recent years to really look at what we're already doing to show the evidence of what we know. There was a time period where it felt like all the requirements for us were really just trying to make us jump through more hoops that had very little to do with our practical everyday patient care. And the goal of the board at this point really is to let us demonstrate our knowledge and let us demonstrate our competency in the things we're already doing. And so, no, there's no trick here. It is just simply doing a little bit of documentation. It's really quite simple. I mean, most of our questions, one sentence or two sentences is sufficient to answer that question. Collecting the data, which is something that all of us have to do now. It's something that 5 or 10 years ago was much more of a foreign idea to us. But with our interactions with insurance companies and new models of care, new payment models, and these things, it's something that most family physicians have to do on a fairly regular basis. But it doesn't have to be something complicated. It could be something that you can collect in 10 or 15 minutes and it's sufficient to get you the credit. But just showing that you're using the process and impacting patient care. Now, certainly we would hope that most people will see improvement in the care that you are giving because of the project you do. But we also have all had enough experience to know that sometimes ideas that seem really good on paper don't always pan out. You get credit even if you don't manage to improve care. And so certainly you want to be targeting for that. And hopefully most of the time you will see a definite improvement in the care that you're giving. But even if your project finds that, nope, nothing changed or things even got worse, you still get credit for it because it's really the process is what you're getting credit for.
Great.
Hey, Mike, I got a question for Ryan.
Yeah, go ahead.
It kind of follows right along with what he was just saying. You don't necessarily need to show improvement, but some projects could be showing that you are having compliance. So things like hand washing, wearing masks, wearing face shields, following isolation protocols. Hopefully you're doing a good job already. And if you just merely show compliance with those things, I assume that would get credit too?
Absolutely. I mean, if you have a process where you are, you need that improvement component. So you can't do a project that's just looking at compliance, but you can do a project where the goal is to improve compliance. If it's hanging up signs, if it is staff education, and then you can look at it after the fact. And probably because what you need is you need pre-numbers and post-numbers. And if your pre-numbers are 100% compliance, first of all, congratulations, you have the most amazing office ever. But you probably should move on and do something else that I think they would frown on you doing a practice improvement project if you're really at 100% compliance. If your office is like most offices, you're not at 100% compliance, so you can then work on trying to improve it. Whether or not you succeed in improving it, the credit does not depend on that.
Great. So yeah, I guess bouncing off of Brian's kind of question too, so pretty much, any kind of clinical topic. I mean, hypertension or diabetes or, anything in your office or office flow or patient flow or any kind of patient improvement type of topic, I guess is allowed.
This self-directed pathway, there is a clinical pathway. There's also ways that you can do some non-clinical things and get credit for those as well. And so no, as far as clinical topics, absolutely any topic you're interested in, you can apply the same or similar pathway to. And it's really quite convenient and really a nice incentive to do the work you're already doing and be rewarded for that work.
I guess for Dr. McMaster and Dr. Batchelder, I mean, was there any kind of challenges along the way? I mean, was the hardest thing really just kind of coming up with the plan and inputting it and that type of thing? I mean, did you have any kind of stumbling blocks along the way that people may need to know about?
No. Mine was, the work had already been done, and really it was just a matter of putting the information together and getting credit for it. So no, for mine, I can't think of any. The stumbling blocks really were planning the immunization clinics, and there was a lot of work that went into that. It's not as easy as you might think, because you also are not only doing the immunizations, but you're bringing people together. So you had to keep social distancing in mind. When we were bringing people in, we had to keep them separated in the waiting area, keep them separated in lines for the immunizations, keep them separated in the actual patient rooms to get the information, give the immunization, and keep them separated when they waited afterwards for 15 minutes to make sure they weren't having reactions. And then there was also the logistics of getting the vaccine there, because the vaccine, you can't thaw it out too far ahead of time. And obviously at that point, we were wanting to use it all. So that was the real work. But afterwards, no, the project itself really put itself together.
No, my project itself was very straightforward and simple. The hardest part of the project was I reached out to one of my managers and asked for assistance, just having her show me the numbers, pulling the numbers for me. And that's all they do. They handle numbers, they pull numbers, and having her understand I really wanted just a very simple, very limited number. They really wanted to make this a lot more complicated than it was. Like, no, really, I just want very simple numbers. So getting them to understand that it was actually as straightforward and simple as I wanted it to be.
Cool.
And I think that's the hardest part of these projects is often people just kind of overthink them. They think, oh, it can't be this simple. And they try to make it a lot more complicated than it needs to be. And the same thing with filling out the forms. It gets real easy to start writing paragraph after paragraph after paragraph. And before you know it, it's something really complicated. When simple does it, do what you need to for your practice for your patients, and don't try to make it more complicated than it needs to be.
Cool. Brian, you're muted. You're still muted.
Mouth is moving and nothing's coming out.
There you go.
That's exactly right. You want to keep it focused. So, I'm one of those docs that kind of looks at everything, and I want to do an immunization project on all immunizations, and that doesn't work. You want to keep it narrow and look at only one aspect, one immunization. Keep your focus when you do these projects.
Cool. All right. Well, as we kind of close things up here, I will ask our panelists to kind of have some closing thoughts. I guess we'll start with Dr. McMaster and Dr. Batchelder as far as, anything you'd like to share that you haven't shared already for this process. And do you have an idea for your next improvement project? Dr. McMaster, go first.
Really, I think this was the easiest, well, outside of the hand washing project, I think this was the easiest practice improvement project that I did. So I definitely, those who are thinking about doing it would certainly encourage you to do it. I know the staff had mentioned to us that the health disparities project is a new project that's out there. So that one sounds rather interesting to me. So I'm thinking about maybe doing that one for my next upcoming one.
Great. Thank you. Dr. Batchelder.
Yeah, I've kind of wondered if the ABFM thought it was strange that all of a sudden they were getting all these COVID immunization projects from across the United States when I shared this project with all the other states I mentioned before. I think the thing I'm going to be looking forward to is, now that we've done this once across ChenMed, I'm going to try to make this a regular thing that we're sharing projects and learning from each other. I think best practices is the real key here. And I think it'd be neat, actually, if we could take some of the great projects that maybe you hear about and put them on the OAFP website so that we can share some of this information so we're not all the time recreating the wheel.
Yeah, Dr. Kaufman, I guess that's kind of one of the positive unintended consequences, I think, is what the board is trying to do, is have physicians at least think about improvement projects. And once they do one, they'll probably do another, and then that'll kind of carry on. So what are your closing thoughts tonight?
Yeah, I think it's a great idea as you're approaching any topic to be thinking about, okay, how can I implement this in my practice? How can I improve my practice? One thing I did with a residency group I worked with, we did KSA on care of children, and then did a practice improvement project related to that KSA. So after we sat there and kind of talked through those questions, it was a great opportunity to say, okay, now let's talk about how you're caring for children in your practice. Let's do this project. Let's get you credit and also apply what you've learned. So I think that's always kind of a great way to approach is whatever you're learning about, whatever is the challenges you're facing in those practices. Those are great opportunities to think about a practice improvement project. And the self-directed pathway is a great way to get credit for the projects you're already doing.
Cool. Well, great. Well, thank you, panel. I want to thank our panelists here for a great discussion tonight on how you can get credit for things what you're doing. As we do close up, I just want to remind you again, this session is part of the OAFP's COVID-19 self-directed clinical pilot campaign that is being supported by a grant provided by the AFP Foundation Philanthropic Consortium, and we thank them for that. And if you want to check out this session or any other session of Bite-Sized Learning, go to ohioafp.org. And I think that's it. So thank you, panel. Say wave goodbye to everybody. Bye. Good night, everybody.